Welcome back to a few minutes with me again in child neurology. So this time I'm going to a school to speak about mental health and physical health and well-being for children. And while I was speaking to the sixth formers, one of them asked me that I want to become a doctor when I grow up. What does it take for me to become a good physician or a good doctor or a good medical student? Or how can I become a medical student? So that brings me to this topic today, that if any sixth former or a young child or a student wants to become a doctor, there are a few key attributes which one has to have to become a good medical student or a good doctor. So let's look at a few key attributes which I always say that if you want to become a physician, surgeon, any sort of medical professional, you've got to have these 5 attributes, as I always like to say. The first and the foremost is, which is the most important part, is empathy. I cannot emphasize enough how important empathy is. If you are not empathetic or if you do not have empathy for other individuals, for humans, for any living being, then you are not going to make a good doctor, I'm afraid. You have to care for other individuals, and it's a very long course of your life. You're going to live this profession all through your life. So if you have empathy, you're going to do a really good job looking after fellow human beings and mankind. So take it from me. This is the most important part or attribute which we all physicians and doctors and surgeons should have when we are dealing with patients. Second important one is passion. If I'm not passionate about what I do, I'm speaking to you out in front of the camera. If my passion is not coming through what message I want to come across, then I might as well not do it. So you should do what is passionate. And if you feel passionate about helping others, treating patients, and help people who are suffering, and if you're passionate about it, then you should go for this profession and go into medical school. Third, again very important, is listening. If you're not a keen, avid listener and you're not going to sit and listen to your patients, what they're going through, I'm afraid again you will not be doing a good job. So in my profession as a pediatric neurologist, sometimes I have to spend 45 minutes to an hour to listen to the whole story and the history which the parents are giving me. If I'm not going to do that, then I'm not going to come to a good conclusion what this child, he or she, is going through and how I can help them. So you've got to be a very good avid listener or good listener to understand the problems these patients are going through. Number 4, patience. One has to be very patient when one becomes a physician. So if you're going to go into medical school, remember that patience is the key. As I said before, it's a long road. There's a lot which you have to go through as a young person when you go into medical school, then you become a physician, a resident, and ultimately you become a consultant. You've got to be very patient because the results are not going to come overnight. There's a lot of hard work. I've not put hard work there because anybody who wants to become a doctor in medical school has to do the grind, has to go through hard work. But you've got to be patient. Things are not going to change overnight for you. You've got to study hard, you've got to work hard. You may have to do lots of nights during your residency and all. So be patient and look after yourself. It's not just about looking after others, you've got to look after yourself as well, and that's where patience comes. So if you're patient enough, you go and do things which you enjoy in life as well, and that will make you a good physician or a good medical professional. And the last point is called lifelong learning. I have been a consultant since 2013-14, and I'm still learning on my job. I did my medical school, I became a consultant, I did a residency program, became a consultant. I'm still learning. Every day in my life I learn something or the other, from my colleagues, from junior residents, from my seniors, from my patients. And you've got to remember that the learning will never stop in your life. So if you are a student out there who wants to become a health professional, wanting to go into medical school, these are the 5 attributes you have to look in yourself. Do I have empathy? Am I passionate about this? This is what I want to do. Am I a keen listener? Have I got enough patience to go through all this? And finally, am I ready to learn throughout my life? If you have any more questions, please feel free to drop some points in the comments box. I'll be more than happy to answer you. My name is Dr. Aman Sohal, and I'm a consultant pediatric neurologist. Thank you.